Hello. Today, we're going to learn about the ultrasound findings of the cricothyroid muscle and the inferior constrictor muscle. Thyroid cartilage appears to be an inverted V shape on ultrasound. Cricoid cartilage appears to be an inverted U shape on ultrasound. This is a thyroid cartilage, and we're going to look at it in the downward direction. If you go down, you'll see the cricoid cartilage. Thyroid cartilage is the largest cartilage that makes up the larynx. It has the superior horn above and the inferior horn below. The cricoid cartilage is the only laryngeal cartilage that completely surrounds the airway. It is broader at the back than at the front. The cricothyroid muscle is a muscle that helps phonation. It's the fan shape like this. This muscle starts at the front of the cricoid cartilage and attaches to the thyroid cartilage. When viewed in cross-section, this muscle is located between the cricoid cartilage and the thyroid cartilage. This is the cricoid cartilage, and this is the thyroid cartilage, and in between is the cricothyroid muscle. In most cases, it is hard to see when you do ultrasound. Inferior constrictor muscle is the thickest of pharyngeal muscle. Thyroid cartilage, or cricoid cartilage, is the origin. This is the thyropharyngeal part, and this is the cricopharyngeal part. The innermost part of the cross-sectional image is the cricoid cartilage, then the cricothyroid muscle, then the thyroid cartilage. And outside of it is the inferior constrictor muscle. This muscle is mostly visible. So let's look at each structure in a clip. This is the inferior constrictor muscle. This is the thyroid cartilage. A little further down, you see the cricoid cartilage. You see the cricothyroid muscle between the two cartilages. This patient happened to see the esophagus on the right. The thyroid gland is positioned in front of all these structures, and if you repeat them again in the cross-section, you see the cricoid cartilage, the cricothyroid muscle, the thyroid cartilage, the inferior constrictor muscle, and the outermost thyroid tissue. This is the case I showed you in the quiz before. I suspect a solid hypoechoic nodule in the upper right thyroid gland. If you look at the image of this patient, this is the inferior constrictor muscle, and this is the cricoid cartilage. This is the thyroid cartilage, but it's not clear because the beam doesn't fit well. If you go down a little bit, you see the cricothyroid muscle between the two cartilages. I'm going to show you a clip of the cricothyroid muscle meeting the inferior constrictor muscle a little bit lower. This person has prominent muscles here, which can accidentally be mistaken for a thyroid nodule. I hope this will help you. Thank you.